Students are to arrive to campus no more than 10 minutes prior to their designated lab time to minimize the numbers of students on site. As they enter the building, they will sanitize their hands and will give faculty their completed point-of-care risk assessment form. Faculty will check and record the student's temperature and review symptoms. These forms will be updated each time a student has a lab on site. Forms will be housed according to program and semester. Students will fill out a separate form for clinical experiences, which will be kept by the clinical instructor and updated with each clinical shift. If a student has a fever or is positive for symptoms of COVID-19, they will not be permitted to attend lab or clinical and must follow up with their program coordinator. Maintaining physical distancing and following the approved traffic flow plan, students will progress to the change room. Students are to bring a clean uniform to change into and a small bag to store their belongings. This bag will remain with them at all times. The floors in the change room will be marked with arrows to allow for one-way traffic through the change room. Students will follow this one-way traffic flow out of the change room and down to the lab space. Exits have been clearly marked. Once at the lab, students will sanitize their hands and don the appropriate PPE for their lab practice. Carts in the hallway will be stocked with the necessary PPE for their specific class. Students will store their belongings on the chair provided at their designated lab station. Labs are set up to accommodate 8 students, either 1 per bed or 2 students per bed staggered around the room. Beds are labeled for use to maximize physical distancing. Wherever possible, students will work at only 1 lab station during their lab practice, minimizing movement in the lab. Any shared equipment will be washed between students, and all bedside equipment, beds, and mannequins will be cleansed at the end of the lab. The last piece of equipment to be cleaned is the chair holding the students' belongings. At the end of the lab, students will doff their PPE, clean their eyewear, wash their hands, and exit following the approved traffic flow plan back to the change room. The traffic flow plan has been designed to prevent any backtracking or cross-traffic in the building. When leaving the lab, students will use the outside stairwell prior to re-entering the main floor to maintain this one-way flow of traffic through the building. Lab times will be staggered between lab groups to allow departing students to clean their lab space, change, and leave campus, and for facilities management to clean the change space prior to the next student group arriving. Students will not be allowed to congregate on site, and student lounge areas outside the lab have been removed. After changing back into street clothes, students will follow the arrows to the stairwell indicated and leave the building. This allows for the continuation of the one-way flow of traffic through the building. Thank you for your patience and your understanding as we work together during this challenging time.